Hello all, wish you all good day. I hope all of you are doing good. This is Vichita, nurse instructor at Athena Coaching Center. Today in this video, I'm going to discuss certain questions that will be frequently asked for exam. And I have taken these questions from ethical concept of nursing. So you can just go through the question, and remember, when you go through the question, you have to read and understand the question and the importance of questions, and then go through the options. And when you go through the options, try to eliminate wrong answers, right? Never go and search for the better, good answer, appropriate answer. Instead of that, what you need to do is you have to read the wrong answer, make sure that this answer is wrong, then eliminate those wrong answers, then definitely you will get correct answers. Okay. So without wasting time, we'll discuss question. So let me share the question to you. Then we will practice. Morning session, our classes, exam preparation sessions, and we'll discuss questions. Last week we completed leadership and management and what else? Neurology, right? And if anyone is not following the questions, not getting the proper rationales, you can just ask me. So this is the first question. The nurse receives a phone call from family member asking for a health-related information on a client being treated for suspected myocardial infarction in the emergency department, and the nurse explains she cannot disclose the personal information about the patient without the client's consent. The nurse knows this request represents which of the following ethical principle? Yes, you can drop your answers. Yes, the answer is okay. Fourth one, confidentiality. Perfectly all right. So what is confidentiality? Not disclosing the personal information. It is indicating confidentiality, right? Not disclosing personal information. Patient information is where permission illande disclose cheyandirikka. Okay, so adineyana confidentiality ennu parayunnathu. So what is beneficence? Last class we learned all these things. Yes.
We are giving, providing good things to the patient.
Yes, beneficence. Yeah, whatever the activities, what we do, that should give a particular positive thing or beneficence for the patient. Okay, fine. Autonomy.
The patient can take the decisions. I think patient can take the decision their own.
Is the right to make a decision is considered as autonomy, right to take a decision. Or patient ayala thanne oru decision edukkunnadine parana perana autonomy. So what is autonomy? It is a right to take a decision, on decision. That is autonomy. What is accountability?
നമ്മൾ ചെയ്യുന്ന കാര്യങ്ങൾക്ക് നമ്മൾ
You are responsible for your own action. That is considered as accountability. Okay, so each one is responsible for your own action. That is usually considered as a okay. So anyone, any doubt regarding this? Accountability, you are responsible for your own action is considered as accountability. When you perform any activities, you are responsible for that. Okay, whatever action it would be. Fine. Autonomy, right to make a decision. ഒരാൾ തന്നെ ഒരു decision make ചെയ്യുന്നതിന് പറയുന്ന പേരാണ് autonomy. Beneficence, whatever the activities that has to be give some benefit to the patient or else the actions what is in the best interest of the client, or it has to be based on the interest of the client. Confidentiality, never. Confidentiality, not disclosing the personal information to anyone else without patient's consent. Clear? So that is confidentiality. So the answer for this is confidentiality. Moving to next question. This is the question. You can read this. 12th question. What is the question here? The nurse is caring for a 48-year-old man with a new colostomy, and which of the following activities best describe the nurse's role as an advocate for the client? Okay, the nurse's role as an advocate for the client. So 48-year-old patient with a colostomy, new colostomy. Nurses have different roles. There are different roles in nurses: nursing leader, nursing manager, nursing advocate, nursing servant. Okay, number of registered nurse, licensed practical nurse, hospice nurse, palliative care nurse, infection control nurse, stoma care nurse, diabetic nurse. There are n number of quality control nurse. Okay, there are n number of roles for nurses. Here they are asking the better describing the nurse's role as an advocate. What is advocate? Advocates are usually, so when I appoint an advocate for me, so usually though whoever is appointed as an advocate, those advocate will talk for me. If I am not speaking, he will speak. Fine. So here, nurse advocate, you are talking for the patient, or you are talking for the benefit of the patient. So what can be this? Prakash, you are attending for the first time, right? This class. Those who are so here, yes, you can just answer. What can be the nurse advocate or the responsibilities of a nurse advocate? We'll see. First one is ensuring the skin is dry before re-adhering the pouch. What does that mean? Before applying a pouch, reapplying the pouch, you need to be make sure that the skin is dry. Okay, it's a responsibility by a registered nurse. Teaching the client how to change and care for the ostomy pouch. Third is providing the client's wife with a list of food to avoid. Explaining to the client that psychological adjustment to an ostomy can take time. So here, job responsibilities of a nurse advocate. Nurse advocate for, she will speak for the benefit of the patient. Clear? So what can be the answer? It's perfectly all right. So the answer is better answer is second one itself. Why? Why fourth one is wrong? I just want that explanation for that. Why fourth one is wrong? Adjustment. So is that statement is true regarding the situation? The statement is true, right? അതായത് ഒരു സൈക്കോളജിക്കൽ അഡ്ജസ്റ്റ്മെന്റിന് കുറച്ച് സമയം എടുക്കും എന്ന് പറയുന്ന സ്റ്റേറ്റ്മെന്റ് ഇസ് ട്രൂ ബട്ട് ആസ് എൻ അഡ്വക്കേറ്റ് വി ആർ ജസ്റ്റ് like working towards the betterment of the patient. So initial thing which is really supporting with the advocate role, that is second one. Fine. Even fourth one is also a thing which is really helpful for the patient. But directly we don't give, immediately we don't give like these kind of, you are just giving the patient or you are just telling the patient that psychological adjustment of ostomy, which it is really hard and you will take more time. Okay, so that is also really supporting the patient. But when we compare between second and fourth, the better answer you can give for second one. And I am pretty sure that first one and third one you don't want to select. First and third one is completely wrong. And if you have any doubts regarding any of option, you can ask me. Okay. And usually I feel like you will get confusion with the second and fourth. So out of the second and fourth, the better answer is second. Clear? Next question. Client with scabies has been admitted to the medical surgical unit. The nurse knows he should use which of the following precaution? What is the precaution to be taken for a client with scabies? How does this get transmitted, anyone? Scabies get transmitted how?
Contact.
Yeah, it usually transmit through the contact. So what kind of precautions you will give? You will take contact. Perfectly all right. Okay. So you have to just learn contact precaution for scabies. Okay. Nothing else to remember from this. Next question. The client who is localized herpes simplex virus infection is admitted to the maternity unit, and the nurse knows the client should ideally be placed in which of the following? Herpes simplex virus. And receive, or in which kind of room you will normally place the patient. Yeah. One is any available room. So we don't allow the patient to lie or be in any available room. See, available room is really important, but in case of herpes simplex, is that contagious disease? Yes, do you feel like it is a contagious disease? Tell me.
It is transmitted through contact.
Yeah, it gets transmitted through the contact. So contact precaution has to be continued. Fine. So option 1 we can remove, and second is single unoccupied room. Okay. And double room with the client who underwent cesarean session 3 days prior. So here twin sharing room with one patient, that is postpartum patient after cesarean delivery. So again child will be there, so you are not allowed this. And double room with a curtain divider, so still there may be chances to get a transmission. Okay, it is not getting transmitted through airborne, but it gets transmitted through direct contact. So the better room that can be given is second one. So what is the answer for this? Yes, please. What is the answer?
Second one.
Second one. Oh, okay.
Hope these kind of a question discussion videos are really helpful for you. So for these kind of same videos, you can subscribe this channel. You can like this channel and please support us. Thank you for watching. God bless you all.